From childhood, we are encouraged to drink it daily, believing it is one of the best sources of calcium, protein, and essential vitamins. However, as we age, our nutritional needs change, and the way our body processes milk evolves. Seniors, in particular, need to be mindful of their milk intake because what was once beneficial in younger years may not be as advantageous later in life. In some cases, excessive milk consumption can lead to unexpected health complications, making moderation and timing crucial. One of the most significant concerns surrounding milk consumption in older adults is lactose intolerance. Many people assume that lactose intolerance only affects younger individuals or those with genetic predispositions, but this is far from the truth. As the body ages, the production of lactase, the enzyme responsible for breaking down lactose in dairy, begins to decline. This can result in digestive issues such as bloating, gas, stomach cramps, and diarrhea. What's even more concerning is that many seniors experience these symptoms without connecting them to milk consumption. Instead of eliminating dairy completely, those affected can consider switching to lactose-free milk, which has the same nutritional benefits but without the discomfort. Alternatively, plant-based options such as almond milk, oat milk, or soy milk provide calcium and other essential nutrients without causing digestive distress. Another crucial aspect to consider is the impact of excessive calcium intake. While calcium is essential for maintaining strong bones, particularly in older adults who are at risk for osteoporosis, too much calcium can be problematic. Overloading the body with calcium from milk and dairy products, especially without balancing it with magnesium and vitamin D, can lead to health complications such as kidney stones and arterial calcification. This occurs when excess calcium is not properly absorbed by the bones and instead builds up in soft tissues, potentially increasing the risk of cardiovascular diseases. For this reason, seniors should diversify their calcium sources by including leafy greens, nuts, seeds, and fortified plant-based milks in their diets instead of relying solely on dairy. One lesser-known issue with milk is its potential interference with certain medications. Many seniors take prescription medications to manage conditions such as osteoporosis, high blood pressure, thyroid disorders, and bacterial infections. Some of these medications interact negatively with dairy products, reducing their effectiveness. For example, calcium in milk can bind with antibiotics like tetracycline and fluoroquinolones, preventing the body from absorbing them properly. Similarly, those on thyroid medication may experience decreased absorption if they consume milk too close to taking their medication. It is essential to consult with a doctor or pharmacist to determine the best way to incorporate dairy into a diet without compromising the efficacy of medications. The timing of milk consumption is just as important as the quantity. Many seniors have a habit of drinking a warm glass of milk before bed, believing that it aids in better sleep. While milk does contain tryptophan, an amino acid that promotes the production of melatonin, drinking milk too close to bedtime can cause digestive discomfort. Some individuals may experience bloating, acid reflux, or an unsettled stomach, which can disrupt sleep instead of improving it. To minimize these risks, it is advisable to consume milk at least an hour before sleeping rather than immediately before lying down. Another surprising fact about excessive milk consumption is that it may not always strengthen bones as expected. While milk is rich in calcium, studies have shown that an over-reliance on dairy products can sometimes lead to an imbalance in calcium regulation, increasing the risk of bone fractures rather than preventing them. This paradox occurs because excessive calcium intake can lead to the body struggling to process and distribute it properly. Seniors should not depend solely on milk for bone health, but should also focus on a balanced diet, weight-bearing exercises, and adequate vitamin D from sunlight to support proper bone density. For those who experience digestive discomfort from regular milk but still want the benefits of dairy, fermented dairy products such as yogurt and kefir offer excellent alternatives. These contain probiotics, which aid digestion and support gut health. Probiotics help break down lactose and improve nutrient absorption, making them a much more suitable option for seniors who struggle with dairy-related digestive issues. Additionally, aged cheeses contain lower amounts of lactose than milk, making them easier to digest while still providing essential calcium and protein. Milk also contains saturated fats, which can be a concern for seniors, especially those at risk for cardiovascular diseases. While full-fat dairy products can provide essential nutrients, overconsumption can lead to an increase in LDL cholesterol levels, which is a major contributor to heart disease. Switching to low-fat or skim milk may help reduce these risks while still offering nutritional benefits. However, some studies suggest that whole milk, when consumed in moderation, may be better than highly processed low-fat alternatives that often contain added sugars and artificial ingredients. The key is to maintain balance and avoid excessive consumption. Another important factor to consider is hydration. Many seniors struggle with dehydration, often mistaking thirst for hunger. While milk does contain water, it should not be used as a primary source of hydration. Drinking too much milk can sometimes lead to reduced water intake, increasing the risk of dehydration. Additionally, consuming excessive dairy can contribute to mucus production and congestion, which can be problematic for individuals with respiratory conditions such as asthma or chronic bronchitis. The quality of milk being consumed is another aspect that cannot be ignored. Many commercially available milk products contain added hormones, antibiotics, and preservatives, which may have negative long-term health effects. For those who prefer dairy, opting for organic or grass-fed milk can be a healthier choice, as these options are free from harmful additives and often contain a higher concentration of beneficial omega-3 fatty acids. Portion control is essential when it comes to milk consumption. While drinking small amounts of milk can be beneficial, excessive intake may lead to weight gain, insulin resistance, and metabolic imbalances. Seniors who consume too much dairy may also experience increased inflammation, which has been linked to various chronic diseases such as arthritis and diabetes. To avoid these issues, it is best to consume milk in moderation and balance it with a variety of other nutritious foods. Milk can also impact digestive health in unexpected ways. Some seniors experience constipation when consuming too much dairy, as high levels of calcium can interfere with normal bowel function. On the other hand, those who are lactose intolerant may suffer from diarrhea when consuming milk. To maintain a healthy digestive system, it is crucial to monitor how the body responds to milk and adjust consumption accordingly. One commonly overlooked issue with milk is its effect on blood sugar levels. While milk contains natural sugars, excessive consumption can lead to insulin spikes, which can be particularly concerning for seniors with diabetes or those at risk for developing the condition. To prevent sudden fluctuations in blood sugar, it is best to pair milk with high-fiber foods such as whole grains or nuts to slow down sugar absorption and maintain stable energy levels throughout the day. Cognitive health is another area where milk consumption should be considered carefully. Some studies suggest that excessive dairy intake may be linked to an increased risk of neurodegenerative diseases such as Alzheimer's. While the research is not yet conclusive, it highlights the importance of consuming milk in moderation rather than relying on it as a primary source of nutrition. Ultimately, milk is not inherently harmful, but it must be consumed mindfully, especially for seniors. While it provides essential nutrients such as calcium, protein, and vitamin D, Excessive intake can lead to digestive problems, cardiovascular risks, and potential bone issues. The key takeaway is moderation. Seniors should focus on obtaining nutrients from a variety of sources, including plant-based alternatives, leafy greens, nuts, and whole foods, to ensure a well-rounded diet. By understanding the potential risks and benefits of milk consumption, seniors can make informed choices about their diet and overall health. It is always a good idea to consult with a healthcare professional before making any significant changes to dietary habits, especially when managing existing health conditions. If you found this video informative, don't forget to give it a thumbs up, subscribe to our channel, and hit the bell icon so you never miss out on our latest health updates. Stay informed, stay healthy, and take care.